Okay, so what do you think the most popular device-related med spa procedure was in 2024? Will it be for 2025? A little hint, it's not Thermage, it wasn't Ulthera, it wasn't HIFU, EndyMed, all those ones you asked me about, it was RF microneedling. Now, there are many devices, so most of you know something called Morpheus. There's Infini, there's Genius, there's Secret, there's Scarlett, there's Silfirm, and there's about 5 more. I just saw a practice post online just before 2025 hit. 10, no less than 10 of these devices for sale. So is it over? How can it go from being the most popular to maybe the most hated? Let me take you through this because there's a lot of misconceptions, and I've owned 3 over the years. I currently have one that I use fairly regularly, and I've of course had it done myself, and I have videos on this channel where I've used it to slim faces on myself, and I go through settings and so on. So I'm well versed to talk to you about this. Your time is valuable. Let's dive into what you need to know about this promised procedure that can help you avoid a facelift. Well, let's start right there with number 1. Is this a facelift killer? Will this replace a facelift? No. And this video isn't, of course, all negative. You need to be armed with the information that's real. But if someone needs a facelift, it's because they have too much skin, too much sag, and often it's the neck, which we'll talk about in a moment, that pushes them over to do a procedure like this to avoid surgery. Because why wouldn't you want surgery? Well, there's a lot of downtime, no matter what people tell you. A lot of people don't like to disclose they've had it done. Of course, they're 50 grand plus. There's high risks. You need way more anesthesia for that than you do for a device in the clinic. And it does sound good. You just go into your clinic, half hour, 30 minutes, a little local anesthetic, you leave. And with RF microneedling, it's like getting a facelift. No, if you have excess skin or too much sag or too much jowls at the kind of lower face along the jawline here, then RF microneedling, especially in a single treatment, is not going to treat that. Could it delay your surgical procedure? Sure, but it also depends on your mindset. How much of a lift, of a tightening do you want? If you're reasonable, a lot of times you can get some nice results, but it does not replace surgery. And remember, surgery produces the most amount of scar in the face. A lot of people ask about Sculptra and about biostimulators and do they cause scar tissue? Yes, you can have a facelift after getting RF microneedling or after getting Sculptra. Many people do. Scar tissue is a heated conversation, but a facelift produces way more than many other procedures that you might get. Now, number 2, I alluded to this. Is a one and done treatment reasonable with RF microneedling? Well, if you're 25 or 35 as a general age, okay, maybe. But for most people coming in at 40, 45, 50, estrogen's going down, they have a degree of sag. I do 3 sessions and I do them 1 month apart, maybe 6 weeks apart, because how long does it take to get results? You're going to see final results at 3 to 6 months. When I go through fat loss with you, it'll all make sense. But price-wise, you want to think about $3,000 for 3 sessions, about $1,300 if you buy them individually. That's kind of the rate throughout the country. Now let's go on to number 3, facial fat loss. This is all over the internet. And people worry about LED, they worry about RF, they worry about RF microneedling. And there's devices designed to help remove fat, especially in Asia. It's very common. People want a slimmer face. Yes, RF microneedling with the right settings, think of depth, duration, and intensity of heat. Those are the 3 main settings that I can change on my device and most. And to that point, the older devices are a little bit better because the newer ones are kind of, quote unquote, dumbed down. I like to get mine very hot to remove fat in areas, and I like it to be superficial and minimal heat to tighten the lower face and the skin in certain areas. So it's very tunable machine, but yes, they can be used to get rid of fat where you don't want fat, and they can be used to maintain fat where you might want to just tighten skin and treat some fine lines. So the answer is yes, and it depends on the provider if they're changing the settings for different areas of the face. You might not ever want to get rid of fat in some areas. Now on to number 4. Can you tighten the skin without thinning the skin. And remember, you're not getting a facelift tightening with this. You're getting some remodeling of the skin. You knock down some acne scars, you knock down some fine lines from vertical lip lines with the right settings, because you don't want to get rid of fat above the lip. But yes, you can get, as you knock down those acne scars and fine lines, it gives the appearance of skin tightening. But you're not like removing a quarter an inch or half inch of skin. So if you're moving your skin back on your face, and I want this, and you're lifting your face up significantly, you're going to be disappointed with the results of RF microneedling. Now, can you use it on the neck? Number 5, because this is a driver to practices. Absolutely you can. Now, there's not a lot of fat in the neck here. So you do way different settings than when you want to get rid of the fat at the jowl, when you want to get rid of the submentum fat, or as in Asia, it's used a lot to slim the face. As masseter Botox is used to slim the masseter, we also use it to slim the face here at a little bit hotter levels. For example, for me, I'm not going to want to lose fat around here. So I just want superficial, not deep needles and not hot needles. Think of it that way. So yes, the neck can be treated, but necks can quickly become surgical because surgery is a good procedure for the neck. And a lot of people, this drives them to practices, and you don't want to be disappointed. Even if you do 3 of these Morpheus microneedling type of treatments, doesn't mean that you're going to get the result that you want. And the result occurs over the weeks and months. So you really need to go back and look at your before pictures, because people forget what they look like. And they sit there and go, well, I don't see any results. You throw up their picture and they go, wow, I look that bad? I'm happy with the procedure. Before I go on, understand, some of these devices, only the tip of the needle heats, and other ones, the whole needle heats. On to the next one, and the next issue that people ask, can all skin types treat with it? Yes. However, you want to be careful if you're using one of those devices where the whole needle heats, or if you're going too hot, or if you're prone to post-inflammatory hyperpigmentation or PIH, because what happens is you'll get brown spots. So the darker the skin, so I'd be a skin type 4. As you go to 4, 5, and 6, you got to be more careful, and the risks go up. Who assumes the risk? You as the patient. You need a great provider to reduce those risks, but you can't take them down to 0. So lighter skin, you can go heavier, deeper, and get more aggressive with the results. But darker skin also doesn't typically get the fine lines that lighter skin does. So there's a balance there. So it does work in all skin types. You just need to be careful, like everything. Now, is this procedure painful? Yes, it's painful. If you're going to the levels where you're going to get rid of fat, then I use nerve blocks with lidocaine, and that works really well. You can use topical. Often topical won't cut it. So if you go to a clinic and you really want some aggressive results, you may want to make sure that they do nerve blocks, because to get to those levels, it is painful. Now, someone on the channel commented the other day, they said, I get 4 to 5 of these a year. I said, wow. So you can see she's getting lighter treatments, probably more often. And to be fair, you could probably reduce that. You don't need to go to a clinic for your heavy hitting RF microneedling. You could use RF microneedling at home, or even plasmazome derma rolling for that matter, and go into the clinic twice a year for RF microneedling. Which brings me to the next one. How often would this be used? Most people get a series of 3 treatments by the age of 40 to 50, and then 1 a year, as long as your hormones are stable, you're not gaining weight, losing weight, or anything's happening in your life where you're losing a lot of collagen, excess sun, poor lifestyle, etc. So is this the end of RF microneedling? Absolutely not, but you need to keep all those factors in mind as you see aesthetics, treatments, settings, the device, the provider. They're all absolutely key in getting your best results. You're now going to want to watch this video about an at-home RF device that you can use, and one down here on microneedling kit that you can use at home to help keep your skin and body beautiful, healthy, and vibrant.